Hello and welcome to this course on epidemiology. In this first lecture on the foundations of epidemiology, we'll be giving more like an overview of all that you will learn in this course. Recently, a news story described an inner city neighborhood concern about the rising number of children with asthma. Another story reported the revised recommendations for who should receive influenza vaccine. A third story discussed the extensive disease monitoring strategies being implemented in a city recently affected by a massive hurricane. A fourth story described a finding published in a leading medical journal of an association between exposure to a particular chemical among certain workers and an increased risk of cancer. These news stories included interviews with public health officials or researchers who called themselves epidemiologists. So, well, who are these epidemiologists and what do they do? What is epidemiology? This lecture intends to answer these questions by describing epidemiology, how it is used today, and some of the key methods and concepts. The focus is on epidemiology in public health practice, and that is the kind of epidemiology that is done in health departments. So at the end of this lecture, you'll be able to define epidemiology, name some of the key uses of epidemiology, identify the core epidemiology functions, describe primary applications of epidemiology in public health practice, specify the elements of a case definition and state the effect of changing the value of any of the elements, list the key features and uses of descriptive epidemiology and analytic epidemiology, and list the three components of the epidemiologic triad, as well as describe the different modes of transmission of communicable diseases in a population. The word epidemiology comes from the Greek words epi, meaning on or upon, demos, meaning people, and logos, meaning the study of. In other words, the word epidemiology has its roots in the study of what befalls the population. Many definitions have been proposed, but this definition on display here, given by J.M. Last's Dictionary of Epidemiology, is quite popular and captures the underlying principles and public health spirit of epidemiology. And it says that epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. Key terms in this definition are study, distribution, determinants, health-related states or events, specified populations, and application. And these reflect some of the important principles of epidemiology. So let's look at these terms individually and study. Epidemiology is a scientific discipline with sound methods of scientific inquiry at its foundation. Epidemiology is data-driven and relies on a systematic and unbiased approach to the collection, analysis, and interpretation of data. Basic epidemiologic methods tend to rely on careful observation, and the use of valid comparison groups to assess whether what was observed, such as the number of cases of disease in a particular area during a particular time period, or the frequency of an exposure among persons with disease, differs from what might be expected. However, epidemiology also draws on methods from other scientific fields, including biostatistics and informatics, with biological, economic, social, and behavioral sciences also contributing. So in fact, epidemiology is often described as the basic science of public health, and for good reason. So first, epidemiology is a quantitative discipline that relies on a working knowledge of probability, statistics, and sound research methods. Second, epidemiology is a method of causal reasoning and based on developing and testing hypotheses and grounded in such scientific fields as biology and behavioral sciences, physics, and economics to explain health-related behaviors, states, and events. However, epidemiology is not just a research activity, but an integral component of public health, providing the foundation for directing practical and appropriate public health action. and based on this science and causal reasoning. Distribution. So epidemiology is concerned with frequency and pattern of health events in a population. Frequency refers not only to the number of health events, such as the number of cases of meningitis or diabetes in a population, but also the relationship of that number to the size of the population. So the resulting rates allows epidemiologists to compare disease occurrence across different populations. Pattern refers to the occurrence of health-related events by time, place, and person. And so time patterns may be annual, seasonal, weekly, daily, hourly, and weekday versus weekends, or any other breakdown of time that may influence disease or injury occurrence. Place patterns include geographic variation, urban-rural differences, and location of work sites or schools. Personal characteristics include demographic factors which may be related to risk of illness, injury, or disability, such as age, sex, marital status, and socioeconomic status, as well as behaviors and environmental exposures. So, characterizing health events by time, place, and person are activities of descriptive epidemiology, and which we'll discuss more later in this lecture. Determinants. Epidemiology is also used to search for determinants, which are the causes and other factors that influence the occurrence of disease and other health related events. Epidemiologists assume that illness does not occur randomly in a population, but happens only when the right accumulation of risk factors or determinants exists in an individual. To search for these determinants, epidemiologists use analytic epidemiology and to provide the why and how of such events. They assess whether groups with different rates of disease differ in their demographic characteristics, genetic or immunologic makeup, and behaviors, environmental exposures, or other so-called potential risk factors. Ideally, the findings provide sufficient evidence to direct prompt and effective public health control and preventive measures. Health-related states or events. Epidemiology was originally focused exclusively on epidemics of communicable diseases, but subsequently expanded to address endemic communicable diseases and non-communicable infectious diseases. By the middle of the 20th century, additional epidemiologic methods had been developed and applied to chronic diseases, injuries, birth defects, maternal child health, occupational health, and environmental health. And then epidemiologists began to look at behaviors related to health and well-being, such as amount of exercise and use of seat belts. So now, with the recent explosion in molecular methods, epidemiologists are also making strides in examining genetic markers of disease and disease risk. And indeed, the term health-related states or events may be seen as anything that affects the well-being of a population. Nonetheless, many epidemiologists still use the broad term disease as shorthand for the wide range of health-related states and events that are studied. Specified populations, although epidemiologists and direct healthcare providers or clinicians are both concerned with the occurrence and control of disease, they differ greatly in how they view who they call the patient. So the clinician is concerned about the health of an individual. On the other hand, the epidemiologist is concerned about the collective health of the people in a community or the entire population. So in other words, the clinician's patient is the individual, but the epidemiologist's patient is the community. And therefore, the clinician and the epidemiologist have different responsibilities when faced with a person with illness. For example, when a patient with diarrheal disease presents, both the clinician and the epidemiologist are interested in establishing the correct diagnosis. However, while the clinician usually focuses on treating and caring for the individual, the epidemiologist focuses on identifying the exposure or source that caused the illness and then the number of other persons who may have been similarly exposed. And the potential for further spread in the community and the interventions to prevent additional cases or recurrence are of prime interest to the epidemiologist. Application. So epidemiology is not just the study of health in a population. It also involves applying the knowledge gained by the studies to community-based practice. Like the practice of medicine, and the practice of epidemiology is both a science and an art. To make the proper diagnosis and prescribe appropriate treatment for a patient, the clinician combines medical and scientific knowledge with experience and clinical judgment and understanding of the patient. Similarly, the epidemiologist uses the scientific methods of descriptive and analytic epidemiology, as well as experience, epidemiologic judgments, and understanding of local conditions in diagnosing, in quotes, the health of a community and proposing appropriate, practical, and acceptable public health interventions to control and prevent disease in the community. Um, let's now look at uses of epidemiology. Epidemiology and the information generated by epidemiologic methods have been used in many ways. Some uses include assessing the community's health. Public health officials responsible for policy development, implementation, and evaluation use epidemiologic information as a factual framework for decision making. To assess the health of a population or community, relevant sources of data must be identified and analyzed by person, place, and time, which we have said is descriptive epidemiology. And they have to ask questions like, what are the actual and potential health problems in the community, and where are they occurring? Which populations are at an increased risk? Which problems have declined over time? Which ones are increasing or have the potential to increase? How do these patterns relate to the level and distribution of public health services available? So more detailed data may need to be collected and analyzed to determine whether health services are available, accessible, effective, and efficient. For example, public health officials used epidemiologic data and methods to identify baselines and to set health goals for the nation and to monitor progress towards these goals, as we have seen with the healthy people goals of 2000, 2010, 2020, and now 2030. Making individual decisions is another use of epidemiology. And many individuals may not realize it, but they actually use epidemiologic information to make daily decisions affecting their health. And so when persons decide to quit smoking, for example, or to climb the stairs rather than wait for the elevator, or to eat a salad rather than a cheeseburger with fries for lunch, they may be influenced consciously or unconsciously by epidemiologists' assessment of risk. Since World War II, epidemiologists have provided information related to all those decisions. So in the 1950s, epidemiologists reported the increased risk of lung cancer among smokers. In the 70s, epidemiologists documented the role of exercise and proper diet in reducing the risk of heart disease. And in the mid 1980s, epidemiologists identified the increased risk of HIV infection associated with certain sexual and drug-related behaviors. So these and hundreds of other epidemiologic findings are directly relevant to the choices people make every day, and choices that affect their health over a lifetime. We also use epidemiology to complete the clinical picture. When investigating a disease outbreak, epidemiologists rely on healthcare providers and laboratorians to establish the proper diagnosis of individual patients. But epidemiologists also contribute to physicians' understanding of the clinical picture and the natural history of disease. For example, in the late 1989, a physician saw three patients with unexplained eosinophilia, That is an increase in the number of a specific type of white blood cells called eosinophils, and myalgias, severe muscle pains. And so, although the physician could not make a definitive diagnosis, he notified public health authorities, and within weeks, epidemiologists identified enough of other cases to characterize the spectrum and the cause of the disease of the illness, and that came to be known as eosinophilia myalgia syndrome. More recently, epidemiologists, clinicians, and researchers around the world collaborated to characterize COVID-19, a disease caused by a new type of coronavirus that emerged in China in late 2019. So, epidemiology has also been instrumental in characterizing many non-acute diseases, such as the numerous conditions associated with cigarette smoking, from pulmonary and heart disease to lip, throat, and lung cancer. Epidemiology is useful too in searching for causes. Much epidemiologic research is devoted to searching for causal factors that influence one's risk of disease. Ideally, the goal is to identify a cause so that appropriate public health action might be taken. One can argue that epidemiology can never prove a causal relationship between an exposure and a disease, since much of epidemiology is based on ecologic reasoning. Nevertheless, epidemiology often provides enough information to support effective action. Examples date from the removal of the handle from the Broad Street pump following John Snow's investigation of cholera in the Golden Square area of London in 1854, to the withdrawal of a vaccine against rotavirus in 1999 after epidemiologists found that it increased the risk of intussusception, a potentially life-threatening condition. So just as often, epidemiology and laboratory science converge to provide the evidence needed to establish causation. For example, epidemiologists were able to identify a variety of risk factors during an outbreak of pneumonia among persons attending the American Legion Convention in Philadelphia in 1976, even though the Legionnaires' bacillus was not identified in the laboratory from lung tissue of a person who had died from Legionnaire's disease until almost 6 months later. So let's now look at the core epidemiologic functions. In the mid 1980s, five major tasks of epidemiology in public health practice were identified: public health surveillance, field investigation, analytic studies, evaluation, and linkages. A sixth task, policy development, was recently added. So these tasks are described, and we'll look at them in more detail in the next slides. Public health surveillance. Surveillance is the ongoing and systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decision making and action. Surveillance is equivalent to monitoring the pulse of the community. The purpose of public health surveillance, which is sometimes called information for action, is to portray the ongoing patterns of disease occurrence, and disease potential, so that investigation and control and prevention measures can be applied efficiently and effectively. So this is accomplished through the systematic collection and evaluation of morbidity and mortality reports and other relevant health information, and the dissemination of these data and their interpretation to those involved in disease control and public health decision making. Morbidity and mortality reports are common sources of surveillance data for local and state health departments, and these reports generally are submitted by healthcare providers, infection control practitioners, or laboratories that are required to notify the health department of any patient with a reportable disease such as pertussis, meningococcal meningitis, or AIDS, acquired immune deficiency syndrome. And other sources of health-related data that are used for surveillance include reports from investigations of individual cases and disease clusters, public health program data such as immunization coverage in a community, disease registries, and health surveys. Most often, surveillance relies on simple systems to collect a limited amount of information about each case. Although not every case of disease is reported, health officials regularly review the case reports they do receive and look for patterns among them. These practices have proven invaluable in detecting problems, evaluating programs, and guiding public health action. So while public health surveillance traditionally has focused on communicable diseases, surveillance systems now exist that target injuries, chronic diseases, genetic and birth defects, occupational and potentially environmentally related diseases, and even health behaviors. So since 9/11, a variety of systems that rely on electronic reporting have been developed, including those that report daily emergency department visits, sales of over-the-counter medicines, and worker absenteeism. So because epidemiologists are likely to be called upon to design and use these and other new surveillance systems, an epidemiologist's core competencies must include design of data collection instruments and data management, descriptive epidemiology and descriptive methods and graphing and interpretation of data and as well as scientific writing and presentation. Field investigation, another core function, as noted as we have said, surveillance provides information for action. So one of the first actions that results from a surveillance case report or a report of a cluster in investigation of a cluster is investigation by the public health department. So the investigation may be as limited as a phone call to the healthcare provider to confirm or to clarify the circumstances of the reported case, or it may go beyond that and to involve a thorough field investigation requiring the coordinated efforts of dozens of people and to characterize the extent of an epidemic and to identify its cause. So the objectives of such investigations also vary, and investigations often lead to the identification of additional unreported or unrecognized ill persons who might otherwise continue to spread infection to others. For example, one of the hallmarks of investigations of persons with sexually transmitted disease is the identification of sexual partners or contacts of patients. And when interviewed, many of these contacts are found to be infected without knowing it and are given the treatment they did not realize that they needed. So identification and treatment of these contacts prevents further spread. For some diseases, investigations may identify a source or a vehicle of infection that can be controlled or eliminated. For example, the investigation of a cause of Escherichia coli 0157H7 infection usually focuses on trying to identify the vehicle, often branded beef, but sometimes something more unusual, such as fruit juice. And by identifying the vehicle, investigators may be able to determine how many other persons might have already been exposed and how many can continue to be at risk. So when a commercial product turns out to be the culprit, public announcements and recalling the product may prevent many additional cases. Occasionally, the objective of an investigation may simply be to learn more about the natural history of the disease, its clinical spectrum, descriptive epidemiology, and the risk factors of the disease before determining what disease intervention methods might be appropriate. Early investigations of the COVID-19 pandemic were needed to establish a case definition based on the clinical presentation and to characterize the populations at risk by time, place, and person. As more was learned about the epidemiology of the disease and the communicability of the virus, appropriate recommendations regarding isolation and quarantine were issued. So, field investigations of the type that were described are sometimes referred to as shoe leather epidemiology, conjuring up images of dedicated epidemiologists beating the pavement in search of additional cases and clues regarding source and mode of transmission. And so this approach is commemorated in the symbol of the Epidemic Intelligence Service, which is the CDC's training program for disease detectives, a shoe with a hole in the sole. Analytic studies and surveillance and field investigations are usually sufficient to identify causes and modes of transmission and the appropriate control and prevention measures. But sometimes analytic studies employing more rigorous methods are needed. Often the methods are used in combination, with surveillance and field investigations, providing clues or hypotheses about causes and the modes of transmission, and then analytic studies evaluating the credibility of those hypotheses. And clusters or outbreaks of disease frequently are investigated initially with descriptive epidemiology, and then the descriptive approach involves the study of disease incidence and distribution by time, place, and person, like we have said. And it includes the calculation of rates and identification of parts of the population at higher risk than others. Occasionally, when the association between exposure and disease is quite strong, the investigation may stop when descriptive epidemiology is complete and control measures may be implemented immediately. And so John Snow's 1854 investigation of cholera is an example. Um, More frequently, descriptive studies like case investigations generate hypotheses that can be tested with analytic studies. And while some field investigations are conducted in response to acute health problems, such as outbreaks, and many others are planned studies. So the hallmark of analytic and epidemiologic study is the use of a valid comparison group. And epidemiologists must be skilled in all aspects of such studies, including design, conduct, analysis, interpretation, and communication of findings. Design includes determining the appropriate research strategy and study design, and writing justifications and protocols, calculating sample sizes, deciding on criteria for subject selection, and which entails, of course, developing case definitions, choosing an appropriate comparison group, and designing questionnaires. Conduct involves securing appropriate clearances and approvals, adhering to appropriate ethical principles, abstracting records, tracking down and interviewing subjects, collecting and handling specimens, and managing data. Analysis begins with describing the characteristics of the subjects, and it progresses to calculation of rates, creation of comparative tables, like 2 by 2 tables, and computation of measures of association like risk ratios or odds ratios, test of significance like chi-square tests, confidence intervals, and the like. These are concepts and terms and techniques that will be treated in more detail later in the course. And so many epidemiologic studies require more advanced analytic techniques such as stratified analysis, regression, and modeling. Finally, interpretation involves putting the study findings into perspective, in identifying the key take-home messages and making sound recommendations. And doing so requires that the epidemiologist be knowledgeable about the subject matter and the strengths and weaknesses of the study. Evaluation. Epidemiologists who are accustomed to using systematic and quantitative approaches have come to play an important role in evaluation of public health services and programs. Evaluation is the process of determining as systematically and objectively as possible the relevance, effectiveness, efficiency, and impact of activities with respect to established goals. Effectiveness refers to the ability of a program to produce the intended or expected results in the field, and effectiveness differs from efficacy, which is the ability to produce results under ideal or controlled conditions. Efficiency refers to the ability of the program to produce the intended results and with a minimum expenditure of time and resources. And so the evaluation itself may focus on plans and trying to make sure that everything is right for the program to go on properly and in a way that makes it on course to succeed. And that's what we call formative evaluation. Or it may focus on the operations of the program, and which means trying to find out if it is being implemented as planned, and that is process evaluation. Or the evaluation may actually be geared towards assessing the impact, the outcomes or the impact of that program, which we call summative evaluation. Or it could be a combination of any of these. And so evaluation of an immunization program, for example, might assess the efficiency of the operations, the proportion of the target population immunized, and the apparent impact of the program on the incidence of vaccine preventable diseases. Similarly, evaluation of a surveillance system might address operations and attributes of the system, its ability to detect cases or outbreaks, and its usefulness. Linkages. Epidemiologists working in public health settings rarely act in isolation. In fact, field epidemiology is often said to be a team sport. Um, During an investigation, an epidemiologist usually participates as either a member or the leader of a multidisciplinary team. Other team members may be laboratorians, sanitarians, infection control personnel, nurses, or other clinical staff, and increasingly computer information specialists. So many outbreaks cross geographical and jurisdictional lines. And so co-investigators may be from local, states, or federal levels of government, academic institutions, clinical facilities, or the private sector. And to promote current and future collaboration, epidemiologists need to maintain relationships with staff of other agencies and institutions. And so the mechanisms for sustaining such linkages include official memoranda of understanding, sharing of published or online information for public health audiences and outside partners, and informal networking that takes place at professional meetings. Policy development is another core function, and the definition of epidemiology ends with this phrase, and the application of this study to the control of health problems. And so, while some academically minded epidemiologists have stated that epidemiologists should stick to research and not get involved in policy development or even make recommendations, public health epidemiologists do not have this luxury. And indeed, epidemiologists who understand the problem and the population in which it occurs are often in a uniquely qualified position to recommend appropriate interventions. As a result, epidemiologists working in public health regularly provide input and give testimony and make recommendations regarding disease control strategies, reportable disease regulations, and policies revolving around healthcare. As with all scientific endeavors, the practice of epidemiology relies on a systematic approach. In very simple terms, the epidemiologist counts cases or health events and describes them in terms of time, place, and person. He then divides the number of cases by the appropriate denominator to calculate rates. and it goes ahead to compare these rates over time or for different groups. And before counting cases, however, the epidemiologist must decide what a case is, and this is done by developing a case definition. And then, using this case definition, the epidemiologist finds and collects information about the case patients, and the epidemiologist then performs descriptive epidemiology by characterizing the cases collectively, according to time, place, and person. And so, to calculate the disease rates, the epidemiologist divides the number of cases by the size of the population. And finally, to determine whether this rate is greater than what one would normally expect, and if so, to identify factors contributing to this increase, the epidemiologist compares rates from this population to the rates in an appropriate comparison group using analytic epidemiology techniques. So these epidemiologic actions are described in more detail later, and subsequent tasks such as promoting the results and recommending how they can be used for public health action are just as important.